body, complex systems working together. 600 muscles, millions of nerves, one brain, 3 billion electrical impulses.
Hi, I'm Greg Litton, and I'm here today with Dr. James Frost. Dr. Frost is another part of the great team here at the Medical Center Clinic. Dr. Frost, thanks for joining us.
Nice to be here.
Plastic surgery, plastic surgeon. Tell us a little bit about what you do.
Well, plastic surgery is a big group of things. A lot of people tend to think just of the cosmetic and the more fluffy, more fun sort of procedures. We do a wide range of things from skin cancers to reconstructive type of surgery after trauma, after breast cancer surgery. We do reconstruction there. And then we do the fun, more lighthearted in general reconstructive surgeries for cosmetic purposes, such as facelifts and eyes and tummy tucks and breast enlargement, breast reductions. So wide range of different things.
Tell us a little bit about your background, where you went to school, how you got your training, because I know you've had extensive training.
Yeah, I went to college a few different places, but ended up then in my home state of South Dakota, where I did my medical school for 4 years. After that, I went to Michigan, where I did 4 years of general surgery residency, and then to Kansas City, Missouri, where I did 2 years of plastic surgery residency. Then I've been at the medical center since then, since 1989, coming up on my 20 year in August.
Now tell us, how in the world did you go from South Dakota to Kansas City to Pensacola?
Got a little warmer on each move down. South Dakota is a nice place in the summer, and it's an extremely cold place in the winter. Kansas City, a little bit better, and Pensacola, a little bit better than that.
To me, it's pretty fascinating knowing that you've had 4 years of general surgery training and then 2 years of plastic surgery training, and now you've been performing surgery for over 20 years. That's a lot of training.
And you know, the 20 years since the initial training is probably the most important of it all. You certainly needed that base, and I think the base in general surgery is probably the most important part of it, because you get a wide range of experience and wide range of taking care of emergencies and traumas. During that 4 years, I also did quite a bit of plastic surgery, so I had that as a background before I went into the specific plastic surgery training.
I know there's two basic, general fields we're going to talk about: reconstructive and as well as cosmetic surgery. Are there differences for you on those sides, feelings-wise? Or I know somebody comes in for reconstruction, maybe had an accident, versus cosmetic. How does that work on your side, or how do you feel about the two different ones?
I think they're both equally fulfilling for me and equally important for the patient. You can have somebody who had something taken away from them, such as a breast or a good-looking face that now has some trauma and some scars to it, and you get a good fulfillment for them by trying to reconstruct that and trying to give them back something they've lost. But I think for people who have cosmetic issues, it's just as important to them that they never had what they're trying to attain. And I think that they get just as much fulfillment and just as much improvement in their life by changing something that bothers them. I see people quite a bit who have really focused on something and they've let it keep them from accomplishing. And if you can fix that for them. I'm thinking of a girl right now who had, this was reconstructive, she had just a very unattractive growth on her nose. And she was so embarrassed by it that she stayed home. She was trying to take home courses instead of going to college. By a fairly simple procedure of taking that off, it really made a difference for her. She went on to feel comfortable with college. I just saw her back here a month ago, and it had made a huge difference, just what I thought was a relatively small procedure. So even something really small like that can be very fulfilling, and it really was a pretty small procedure.
And it sounds like what you do is certainly rewarding.
Yeah, the things that are most rewarding are when the patients get what they're trying to accomplish. And that's one of the things I ask a lot is, have we accomplished what you wanted? And most fulfilling is when they say, yes, that's what I came for, that's what I got, that's what I was trying to accomplish.
Now, your job, I assume, when they come in to see you for a consultation and talking about, do you generally lead them? Do they want your advice on what they should do, or do they generally come in going, this is what I want?
I have a way that I lead that. Sometimes people come in and say, I want this procedure, particularly in the face. They'll say, I want a facelift and a brow lift and eyelid surgery. I'd rather they came in and said, this is what bothers me. This is what I want to change. Let me help you pick what procedure will accomplish that. Sometimes that procedure may be Botox. As compared to you're telling me you want your brows lifted, I might recommend Botox, a smaller procedure. So rather than the patient picking the procedure, they should try and identify what it is they're trying to change. And some things that's obvious. My breasts are too small, I want them larger. My breasts are too large, I want them smaller. So that's an obvious answer. But a lot of times people come in with a predetermined notion of the procedure they want. I think they should come in more with an idea of what they want to change.
With an open mind and let you, the expert, kind of guide them.
Another example of that is, I want liposuction. Well, you really need a tummy tuck. Or I want a tummy tuck. Well, we could do it with liposuction, which is a lot smaller procedure. So again, look at what you want to change as compared to trying to pick the procedure. With the internet, everybody is out looking and reading and trying to put themselves into that slot. Oh, that looks like me. That's what I want to have done. And there's a little bit of danger in that, because usually that's not you, and you are different than that. And that's where you go to the expert, the person with the experience, to give you the advice on what will work for you or what won't work.
Medical Center Clinic Today is brought to you by the Medical Center Clinic, a leader in medical innovation, serving Northwest Florida for over 70 years, with over 75 physicians, 25 medical specialties, and 600 medical professionals. Medical Center Clinic, healthcare centered around you.
Let's talk about a few of the procedures. Let's go through, you mentioned facelift. Who generally comes in? Who does that typically help?
Yeah, facelift is usually starting in the mid-40s. It's getting a little bit earlier than it used to be. Used to be we saw people more like 60 and above, and now we're seeing mid-40s, 50. Tends to be that anniversary year, like I'm 49, I'm 59. They're not looking forward to that next decade of life and starting to see. And what a facelift does, let me back up there, is facelift is from here to here. It's not this. This is brow lifts or eyelid surgeries, but a facelift really treats the jowls, which I've grown for demonstration purposes, a little extra fat, skin in the neck, and a little bit of the folds here, and especially folds here. So facelift really is a lower facelift, neck lift, etc. And the people we see are the ones that are starting to see their mother or their father in their face, and they don't want to get there. So I think the person in their mid-50s is probably the best person for that, because we can usually make the best change. It's the person that's gone too far that's harder to help. Once you get so that this is really hanging, that's when it's harder to fix.
I was going to ask, we've all seen, and I hate to use these examples, in Hollywood with some
It's
people.
okay, we know who they are.
Yeah, exactly, everybody does.
Yeah.
That they've either had too many or...
I think the main thing you're seeing in Hollywood is Botox, and they're using it in multiple places on the face. Traditionally, or initially, Botox was used pretty much in the forehead and for these creases between the eyes up here. And it's moved around enough now that it's paralyzing the face. And what Botox does is paralyze your muscle. It makes it so the muscle can't constrict and can't pull these lines.
Can't make the wrinkles.
Can't make the wrinkle. They're using it in funny places. And people who have had too much surgery sometimes have their muscles paralyzed because some of the nerves have been cut going to them. And Joan Rivers is the classic example, and she makes as much fun of herself as any of us make of her. She looks beautiful holding still, but when she starts to talk, that's when you realize there's something not quite right, and then she jokes, "Is my face moving?" And it's not. It's not moving the way you want it to. That's something that we really avoid, really don't want that look, but a lot of people come in afraid that that's what they're going to get, or that,
Exactly.
in a wind tunnel sort of look. I spend a lot of time educating and showing photographs of what people might expect, a lot of pre and post-op photographs of patients that we've done. None of that. really want to avoid that as much as possible. The ideal cosmetic surgery is one that no one knows you've had done.
Now, are some of those caused, like you mentioned, the wind tunnel, or is that caused from having too many surgeries, or caused from somebody trying to maybe go from 60 thinking they can look 30? Or
Yes, both. That's well put. It's trying to do too much, or like I said, the person who's a little bit too far gone, they have too much skin hanging, you end up kind of having to drape it back up, and they still have the drapes of skin, so that it's hard to get that up there. And then overdoing by too many times. One of the other examples, and I was going to talk about other procedures, are brow lifts, eyelid surgery. Another Hollywood or Nashville example of that is Kenny Rogers. Men look best with their eyebrows pretty much straight across, and if you look at any of your good-looking Hollywood stars, the Brad Pitts of the world, they have straight across brows that if you looked at them you'd say, well, they're kind of a little low, but that's a masculine look. Kenny Rogers now has a feminine look because his brows are arched. Last thing you want to do on a man. So when you're doing a brow lift on a man, you have to be much more gentle and make sure you keep it straight across.
are there, for all these type of procedures, is there a limit that maybe that you shouldn't do more than a couple, or something, a general feel for that?
I think it's more of an individual thing, and it's a matter of not overdoing. Now, a lot of times the patient is the one driving that, and I think Michael Jackson's probably the best example of that. My understanding is there were plenty of surgeons who turned him down on doing his nose again, and that's why he's run into trouble and had major complications from that. So generally speaking, if you go to a reputable plastic surgeon, they're going to tell you no. Same thing happened, my understanding is, with Kanye West's mother, when she was told by one surgeon, no, you're not a candidate for this, and she went doctor shopping. So in general, if a surgeon tells you no, he's not doing that to hurt your feelings, he's doing it to protect you.
So it's not a good idea to go try and find another surgeon that'll do what you want.
Let the surgeon help guide you into what will work for you. And again, that internet can be a bad thing because you go read it and think, oh, that's me. But you don't know some of the nuances and some of the specifics of why that won't work for you, and why the surgeon with their experience is saying, I understand what you want, but we can't get there from here. So let's find a compromise and accept what we can accomplish and not try and push beyond it.
I think it sounds like, going back to what you said initially, is that patients should try and come in open-minded, not
Yes.
having made up their own mind.
Right, and I consider our first meeting as an educational experience. Don't come in and say, I am going to have this procedure. Come in and say, I'm interested in finding out what will help me, what won't, and then making an educated decision on whether I should move forward with this. Too many people come in and just say, I'm going to have this procedure. You're going to go through and tell me about it, but I'm not going to listen because I'm going to have this procedure no matter what you say.
Well, I think it ought to be common sense, if you're coming to somebody that's been doing this for 20 years, to maybe lean on your expertise a little bit more.
You'd hope so, but there tends to be, particularly in younger individuals, I think, there tends to be a little bit more of, my girlfriend had it done and I'm going to too. As women mature, I think they get a little bit smarter in that and are more willing to listen.
Medical Center Clinic Today is brought to you by the Medical Center Clinic, a leader in medical innovation, serving Northwest Florida for over 70 years, with over 75 physicians, 25 medical specialties, and 600 medical professionals. Medical Center Clinic, healthcare centered around you.
Now, you mentioned a couple other procedures, the tummy tuck, liposuction. Tell us the differences on those.
That's one of the more fulfilling procedures. I think both of those can be very fulfilling for people and make a big difference. Liposuction is done for fat. You can't exercise fat. I see people all the time that say, I'm doing these crunches, but this fat won't go away on my stomach. Well, you can't exercise the fat on your stomach. You can exercise the muscles in your stomach, but that's not affecting the fat on your stomach any more than it is the fat on your arm. You're having a body systemic effect by exercise, but you can't target fat. That's what liposuction is for. For someone that, with guys, it's very often the love handles or a little bit of extra belly down the bottom, where they're pretty healthy guys, they're out running, they're doing their stuff, but that's just the way they were built, and they can't get rid of that. For women, it tends to be, especially after childbirth, they've got a little pooch in the middle. For younger women and all women, it's the thighs, the outer thighs, that are particularly bothersome to them. So the ideal candidate for liposuction is someone who's at a good weight. They're not looking for a weight loss. It's just a contouring procedure. It's, gee, I wish, I can't fit my pants the way I'd like to. The waist is okay, but I've got these big thighs. So I have to buy my pants bigger, and it's too big at the waist. And so you contour the thighs down, fit the rest of it. And they probably don't change pant size, but now those pants fit. Same thing with the stomach. They may not change pant sizes, but those pants at the back of the closet that they've been about to get into, as soon as they lose that 5 pounds, now they can get into it comfortably, and they're less likely to feel they have to lose weight. For guys, we run into a lot of it with guys in the military who aren't built lean. They're built a little bit stockier, and there's some requirements with military of neck versus waist size, so we can get the waist size down to match that a bit better. So although none of the Marines will tell you they've been in my office, I can tell you they have.
Well, with the lipo, just looking from the outside, knowing a few people that have had it or overheard, I read word 2 to 3 days back to work after lipo, because I'd always heard that it was very painful.
It isn't. Television likes to sensationalize things, and they'll show you in the operating room making it look like you're beating someone up. But they have sensationalized.
With the old Hoover vacuum cleaner.
Yeah, that's it. They have sensationalized it to make it. They've purposely made it look bad. It's not bad. We usually do it with people asleep. We can do it with you awake, but most times people are more comfortable asleep. And afterwards, they usually say they're bruised, they're sore. We very often do it on a Friday, and they're working on Monday.
Doc, you mentioned tummy tucks. Who is a tummy tuck candidate?
Tummy tuck is a cute little word for a big procedure, and that's where if you can do just liposuction, it's great. Again, I said you couldn't exercise fat. You can't exercise skin either. So if you've had 5 kids and your muscles are stretched out and your skin is stretched out, or you've lost a lot of weight and your skin didn't stretch with it, that's what a tummy tuck is for. We do two main things with that. We're removing the extra skin along the bottom of the stomach, and then usually also repairing muscles. And it's not that the muscles are broken, but we're pulling the muscles together to tighten that waist, and can make a real difference in flattening the stomach that way.
Who would be a candidate for that type of procedure?
We do a lot of people who've had gastric bypass or have lost weight with other methods. Those are probably the biggest procedures because they often have a lot of skin hanging. You'll see somebody walking around where you can tell they've got an extra roll in their stretch pants. Those are the ones that make the biggest differences. Other than that, it's the 35-year-old woman who's had a bunch of kids and just nothing she can do to make a difference with that skin. On guys, it tends to be ones who've had big weight loss, and now they've got the skin hanging and they can't get rid of it. For some of them, it's a little bit of a medical issue in that they'll have the folds hanging and they actually get rashes underneath them. So to get rid of that skin-on-skin sort of a rash, tummy tuck will do it.
Well, I know
But a big operation.
Well, I know everybody out there is waiting for us to get to breast surgery. So let's talk a little bit about, there's a number of different breast surgeries, procedures. Let's go over a few.
4 basic procedures. Breast augmentation, which is implants, breast lift, breast reduction, or breast reconstruction, which is big, huge topic. Should we take them in that order?
Absolutely.
Breast augmentation is 2 groups of people. It's the 18 to 21-year-old who never developed and wants larger breasts. The second group is the one who's had their babies and the breasts maybe grew quite a bit during the pregnancy and now they've shrunk back. And they're looking for augmentation. Augmentation means breast implants. that surgery, interestingly, is one of the more popular done surgeries and continues to have lots of misconceptions, particularly surrounding the implants. We have two types. We have saline and we have silicone gel. The saline have never really been questioned as far as their safety, and the reason is you pop it, it's like a balloon, it leaks out and it's gone, and you know you have a flat tire. The question with the silicone gel implants was, in the past, did they cause some diseases? Diseases of particular concern were rheumatoid type diseases, scleroderma, rheumatoid arthritis, fibromyalgia. They're all diseases that no one wants to get. So the question was whether the implants caused those or not. In the late 80s, early 90s, there were a lot of questions raised about that and whether silicone gel implants may increase your risk of getting those. At that time, we didn't really have enough studies to say that they didn't. We didn't think they did as plastic surgeons, but couldn't prove it. So the FDA pulled them off the market after that in America. Now, they always stayed in the market in Europe, so that gave a good place to have good studies. And they continued to do studies in the United States as well. So 2006, they came back and said, okay, it doesn't look like it causes any of those diseases. The implants have been modified a little bit, but not significantly. The outer shell is a little bit different than it used to be. And the implants came back in November of 2006. Few restrictions on how we can use those. You have to be over a certain age, and the FDA does recommend that you have MRIs. And again, because we may not know they're broken. With the saline, they leak out, it's gone, it's a flat tire. With the silicone gel, we may not know it's broken. So they do recommend an MRI evaluation of that at about 3 years and every other year thereafter.
Well, that's good. I mean, I'm going to let you expand on it. That's good for the general public, somebody like me, because like you said, the misconception is boy, they had all these problems and now they fixed them and come back. But what you've told me is that that's not really the case.
No, and the implants that we have now have the same problems as the implants that we had in the 90s. There are problems we're aware of. We work around them. Main problem, and people have always heard that the implants get hard. The implant doesn't change itself. What happens is scar tissue around it pushes down on it, and if that happens, the implant can feel hard and it can be moved to one side or up or down a little bit. So that's always been an issue. It's an issue with saline implants. Any implant can get infected. Pretty unusual, actually, with both types of breast implants. So there's pluses and minuses to both of them, and that's something we always discuss when people come in. In some people, I think saline implants do fine for them. In others, they really need the silicone implants to get what they want. So that's part of the consultation process. Again, we talked about education, and that's the purpose of doing it.
With the implants, does that go along the same lines as some of the other cosmetic surgeries or reconstructive surgeries where it shouldn't be done a few times, or does it really matter?
One of the things I stress to people who are having implants is if you're having this surgery, you're going to have more surgery. So it's not a matter of doing it and redoing it. It's a matter of if you have an implant, it's going to break someday. We're going to have to replace it or remove it. And that's a dilemma, I think, for women in their 50s who now are saying, okay, I had these implants, they're 25 years old. What do I do with them? They seem okay. Or I just had an MRI because of some mass and I found out my implants are broken. What do I do with them? Well, the recommendation is always take them out because there are potential problems of them causing some unusual scarring. But some women then say, I was 100 pounds when I had these put in and now I'm 150 pounds and now I don't really need them. So take them out, leave them out. For some women, they've developed a lot more sag to the breast during those 30 years. And then we're talking about doing a breast lift, leaving the implants in, taking them out, but there are lots of options.
Let's talk about some of the other procedures.
Well, the two other procedures that I mentioned, breast reduction and breast reconstruction, are both generally paid for by insurance. People who have very large breasts, and we're talking the double D, triple D, and then they move up into F, G, and all sorts of weird cup sizes, have significant physical symptoms from those. They typically tell me they're pain in the neck, going in the shoulders, bra straps digging into their shoulders, pain between their shoulder blades that they just can't get rid of. It's kind of that burning pain. They're always embarrassed when I ask, do you lift your breast to alleviate that? But they all giggle and say, yeah, how did you know? And it's because they all do that. They're in such pain that they tend to do this to take the discomfort away. So breast reduction, while it's probably not the most aesthetic procedure I do, is really one of the more rewarding procedures I do, because the patients are some of the most grateful, because they have all day, every day, they're hurting.
Pain.
And you alleviate that. People very often say in the recovery room, I felt better. I could, I had some pain from the surgery, but I could tell my back was already better. It didn't have that constant pull on it. So because those are physical symptoms, insurance companies generally reimburse for that. So I do maybe one a year that's not paid for by insurance for breast reductions. And breast reduction sometimes makes the breast look better, but often it doesn't. Often you're putting scars on a breast that didn't have scars. So when you're doing a breast reduction, you are doing something for pain. You're not doing it to make them look better. So it really isn't a cosmetic procedure. Breast reconstruction, generally done for people who have had breast cancer or have a very strong family history of breast cancer. Maybe somebody who's had a biopsy a year and their sister had cancer, and so they want to get rid of the breast before they have cancer. So those are procedures that we do to try and recreate a breast as best we can. And there are a lot of different procedures that we can do for that. Some of them involve breast implants, some of them don't. Sometimes we do a tummy tuck and use that tissue to recreate a breast. So there are lots of options there, and again, something insurance pays for. One of the few things that there's federal law that mandates that breast reconstruction is paid for. So all insurance companies have to cover that.
Now, Doc, we've talked about all these different procedures and plastic surgery. Real quick, I'd like to ask you about some of those stuff. You obviously have a passion for beautifying.
Yeah.
I know you've done a lot with the landscaping out here at the Medical Center Clinic, which is beautiful.
We're getting there.
And with the saltwater aquariums. Tell us a little bit about that hobby.
I just like pretty stuff. An aquarium is landscaping underwater. They call it aquascaping. And everything you see behind us here is alive. It's most of them are animals, although not what we traditionally think of as animals. All those corals are really animals, not plants. And anything I can do to make something look better, I guess. We're working on our landscaping. Our pond, which unfortunately got damaged quite a bit in Ogden, we are getting back together, and hopefully the water will be clearing up soon and we'll have beautiful fish. So I like things that look good.
Doc, thanks for joining us. Thanks for educating us. Thanks for letting us get to know you a little bit better.
Appreciate the opportunity.
And for all of you watching, thank you. And remember, if you need a great plastic surgeon, come see my friend Dr. Frost. And if you want a great team on your side, come see us here at the Medical Center Clinic.
Medical Center Clinic Today with Greg Litton is brought to you by the Medical Center Clinic. For more information about today's topic or other health-related issues, visit us on the web at medicalcenterclinic.com or call 850-474-8209. Medical Center Clinic. Healthcare centered around you.